Hi there. What we're going to talk about today is how to wash our hands appropriately with waterless soap and soap and water, and also how to appropriately remove gloves that are considered clean, not sterile. After that, what we're going to do is I'm going to demonstrate how to create a sterile field, and then I'm also going to demonstrate how to put on some sterile gloves. But let's start clean first with the clean techniques. When you are applying a pair of clean gloves, you want to make sure that they fit you appropriately. And to simulate the dirty effect, I'm going to put some material on my hands so that you can see and pretend that actually these are microbes. So now you can see that my hands are contaminated. So what I see everyone doing in acute care is taking that contaminated hand and going underneath here, which you don't want to do, because then you're going to contaminate yourself underneath the glove. So the proper way to take off clean gloves that are soiled is to grab it on the inside here like this, to kind of make a package. Then with your clean hand, remember clean touches clean, dirty touches dirty. You're going to roll this up and then it is placed in the trash. After you remove soiled gloves, it is very important that you use waterless soap and that you cleanse with waterless soap appropriately. When you're using waterless soap, you want to get a good amount on your hands. And what you really need to do with the waterless soap, friction, right? This has a high amount of alcohol in it. It kills a lot of microbes. And you want to keep rubbing your hands, utilizing a lot of friction to get off all the transient flora or microbes that you may be picking up in the environment. And you really rub your hands until the hands are completely dry. So it's a lot longer than what people are doing. And remember, the reason why we're using waterless soap now more than anything is because people weren't compliant with hand washing years ago before they went in a patient room and then when they left it. So this is quick, this is easy. And again, waterless soap can be used when your hands are not visibly soiled. If they're visibly soiled, then you must use soap and water, which I'm going to demonstrate next. Now, remember when you're using or washing at a sink, you have to remember that everything is contaminated. The faucets, the spigot, the sink, and the exterior. So now I'm coming to wash my hands and my hands are dirty. Some people feel better taking a paper towel and opening the faucets. You certainly can do that, but your hands are dirty. You can also take the dirty hand and touch the dirty spigots here and open them up. Once you have the water going, it is very, very important that you wet your hands up, your hands, wrist, and 3 to 4 inches above. So what I'm going to do is I'm going to wet my hands, and now I'm going to get some soap. The point of using soap is that soap applies a lot of friction. Remember, the CDC indicates that we need to wash our hands with soap and water periodically through the day, regardless of using waterless soap, and after any soilage that you notice on your hands. I also have the students in clinical wash their hands in the morning before they start their day to get off all of that transient flora they brought in. Now, when you're washing your hands, it's very important that you go from your fingers, and if there's anything soiled under your nails, you can cleanse it this way. You want to really scrub. It's all about friction to get that transient flora off. You don't want to have a lot of jewelry, because jewelry is a hard surface. And as you know, recently with COVID can live on a hard surface for several hours. You need to wash your hands for a minimum of 20 to 30 seconds according to the CDC. Now I've cleansed my hands. What I'm going to do is now rinse. And again, you always want to keep your hands so that your wrist and hand are pretty much parallel with your elbow. So I'm going to rinse the fingertips up to where I washed. I'm going to rinse, and you wouldn't want to rinse this way. If you rinse downwards, then the contaminated area you didn't wash would go onto your clean hands. Now what I'm going to do is I'm going to dry my hands with some paper towel. You're going to always start at the fingertips. Fingertips downward. Okay. Make sure that you dry your hands well so that they don't end up getting very dry and cracked. Now this is wet, so you don't want to turn off the dirty faucets with this wet surface because it's permeable now. So you're going to discard that. You're going to take a brand new paper towel. You're going to close the hot and cold water that was running, and you're not going to clean up anything in this contaminated area, because then that way you would get contaminated. Remember, artificial nails are not allowed in acute care. There's been many studies that have indicated that it contributes to, first of all, ventilator-associated pneumonia, but also you can't clean that surface appropriately. Also, nails need to be very short. And again, remember, not a lot of excess jewelry. Now what I'm going to do next is I'm going to go over and create a sterile field. Anytime that you get prepared to do any type of sterile procedure, you want to make sure that you wash your hands before. So I just wash my hands with soap and water, but if I hadn't, I would take the waterless soap and I would wash my hands as I instructed you until the waterless soap is dry. Now what I'm going to do today is set up a sterile field. So the concept that you need to remember is that when we set up a sterile field, what we're doing is we're attempting to create a field that we can place sterile items onto. Remember, when you open up your field, the outside of the packages are clean, so I can touch them with clean hands. But when I have my field all ready with all of the items on it, I can only touch the sterile field with sterile gloves or sterile forceps. Okay, so what I'm going to do now is I'm going to open up my sterile field. This happens to be a little miniature dressing kit that I'm going to open up here. Okay, so this is clean. I'm touching clean. Okay, I'm going to take it out of its package. I'm going to make sure that it hasn't expired, because remember, when things are expired, they're no longer any good. Anytime that you open up a sterile field, you need to make sure that you open it up this way. You're going to just touch a 1-inch edge of the drape, and you're going to pull it straight back. Then what you're going to do is touch the 1-inch edge of the drape here in the center. So away from you first. Then you're going to touch the drape 1-inch edge in the center. Then you're going to touch the drape and pull it towards you. Okay. Now let's talk about a few principles of this sterile field. 1. If this gets wet in any way, it's permeable and is no longer considered sterile. If you have a cold and you're sneezing and coughing all over the field, it's considered contaminated. So you should wear a mask if you have a cold. The other piece is once you get this field open and the way you like it and set up, you need to make sure not to turn your back on the field. If you have to leave the room in an emergency, then you want to cover it with a sterile drape. The other piece is always to remember to put this sterile field on a clean surface. Remember, the inside of this is sterile, the underside is clean. And there is a 1-inch edge that we consider dead or non-sterile on this field. So now I have this sterile field, and what I'm going to do is I'm going to drop my forceps on my field. Good. Now what I'm going to do is I'm going to drop a little sponge that I don't have in here that I need on my field. So now I've created a field. Now the other thing that I need to do with this dressing tray is, in order to touch it, I need to put on sterile gloves. If I needed to soak the dressings in sterile sodium chloride, then I'd need to set up a sterile bowl as well, which I'm going to do. A lot of equipment is re-sterilized over and over again. And when it's sterilized, you will see that it has this kind of demarcation on it with a date and time, okay? So I'm going to set up a sterile bowl, and everything is kind of wrapped. Sterile fields are wrapped in the same way that the dressing tray, this sterile field around this bowl, was. So what I'm going to do again is I'm just going to grab the edge away from me. I'm going to grab the edge this way in the center, and then the 1-inch edge towards me. Now anything that falls below the waist is considered contaminated. Now what I'm going to do is I'm going to take my sodium chloride. I'm always going to take these containers and open them with the top down to keep the inside sterile. Then what I'm going to do is I'm going to pour my saline into the bowl, and then I can utilize this. All right. So now in order to touch this sterile field, I need to put on some sterile gloves. Again, you want to wash your hands before any sterile type of equipment is applied, sterile fields, procedures, and gloves. So what I'm going to do now is I'm going to open up this package. And you can see when I open this up, there's this sealed area here. You can put your hands an inch away from that, right here on that inch edge. Open straight back. Inside of this package now, you have what I call a book of gloves. Remember, clean touches clean, sterile touches sterile. So I'm going to get rid of the outer wrapper because the contents of these gloves inside of this package are sterile. So what I'm going to do is I'm going to open up my book of gloves. You can see here that the left and the right hand, but it's fan folded down on the top. So what I'm going to do is I'm going to take this fan folded top, crimp it down so it lays flat. Okay. Then what I'm going to do is I'm going to do the same for the bottom so that it stays flat. Then you have here an edge that's fan folded. You're going to try to go underneath the edge and touch no more than an inch. And then what you're going to do is pull this open so that it lays flat. So what I'm going to do now is I'm going to, if you look at these, the fingers are sterile and the inside of the gloves, which are fan folded up, are considered clean. So I can grab the edge of the inside of this fan folded glove. I'm going to take this and pull it up from the paper. And now what I'm going to do is I'm going to put my hand into the glove, and do not futz around too much with the wrist because you don't want to contaminate the glove. Now, my hand is sterile, so what I'm going to do is I'm going to go under the cuff of the other glove. Keep your thumb out because as you put this on, you don't want that sterile thumb to touch your skin. So now what I'm going to do is I'm going to put this glove on, and now I have my sterile gloves on. So now that I have them on, the thing that we teach our nursing students to do here at Kennebec Valley is to keep your hands above your waist, to keep them in visual contact with your eyes, because we all have the tendency to take our hands and rest them on our chest. So always have them in your visual field. Now that I'm sterile, I can touch my sterile field. I can arrange it in the way that I need to, okay, for this particular procedure. Okay. If I need to drop some dressings in my saline, and now I'm ready to perform my sterile procedure. So remember, sterile touches sterile, all right? All right, that's the end.